So, welcome everyone to our latest InterMET.digital webinar in the ongoing series on opportunities for addressing the challenges and impacts of extreme weather and climate change on business and society. I'm Madeline Thompson, and I'm the head of climate impacts at the Wellcome Trust. In today's webinar, we will focus not only on the threats and challenges facing the public health from extreme weather and climate change, but also on some of the potential opportunities for business, academia, and the public sector to help mitigate and manage them. So let me introduce you to our panel of experts that will be taking us through this discussion. We have Dr. Susan Annenberg of the Milken Institute School of Public Health at George Washington University in Washington, DC. We have Sheikh Dion of the African Center of Meteorological Applications for Development, based in Niamey, Niger. We have Dr. Vijay Limaye of the National Resource Defense Council in New York, and Dr. Pei Huang of the United States Environmental Protection Agency. So we're thrilled to have you with us here today. We see that there's over 200 people registered for this session. How we will do the program will be each of our panelists will open with a short presentation. Following that, I'll make a few comments, and then we'll move to our panel discussion and audience Q&A session. We've had some questions in advance, and we're hoping that you, the audience, are keen to contribute your questions to our panelists via the Zoom question and answer facility. You can access the Q&A facility at the bottom toolbar of your Zoom screen. So we'll come to that, and I'll remind you about that in a minute, but we're very keen to get your questions. So as our panelists present, please jot down some of the issues that you think are most important that they could address in the Q&A. So to get the ball rolling, please allow me to introduce Dr. Susan Annenberg. Susan is an associate professor of environmental and occupational health and of global health at the George Washington University Milken Institute School of Public Health, and she serves as the director of the Masters in Public Health concentration in global environmental health. Particularly interesting aspect of Susan's work is her focus on methods and tools integrating air quality and health into our urban climate for action planning. So over to you, Susan.
Thank you so much, Madeline, and welcome everyone. Good morning, good afternoon, good evening, good day. It is my pleasure to be here with you today talking about methods and tools to integrate air quality and health into urban climate action planning, which is something that has been a disconnect in historical climate action planning efforts, and yet very important to consider because the same sources of greenhouse gases are also emitting air pollutants and affecting human health. And so we would like to move towards a more comprehensive and integrated understanding of how actions to address greenhouse gases and to reduce climate change impact air quality and health in many different ways. The disconnect here is in the geography and the timing of the costs of action to reduce greenhouse gases and the benefits of reducing greenhouse gases for climate change, where the cost of action occurs locally and nearly immediately in the days, the weeks, and the months as the action is being taken by governments or by business or by individuals. Whereas the climate impacts from the reduced greenhouse gases are occurring globally and decades or centuries into the future. And so this is a bit of a mismatch when we start to think about the costs and the benefits of undertaking actions to reduce greenhouse gases. And yet, there are many societal benefits of burning less fossil fuel, and those include clearer air, cleaner water, expanded natural environments for recreation and also ecosystem protection, reduced congestion and noise, improved health in terms of cardiovascular disease and respiratory disease and mental health, as well as cost savings, green jobs, and energy independence. And these societal benefits are occurring locally to the community taking action, and they occur relatively immediately. So if we return back to this disconnect between when the costs of action are being incurred and where the costs of action are being incurred, compared with the global and decades or centuries in the future impacts on climate change, we see that incorporating health and environmental benefits into this equation changes the cost-benefit analysis. So we no longer only have those costs that are occurring on a local and immediate time frame. We also have the many societal benefits occurring on a local and immediate time frame, from clearer air, from more physical activity and less noise pollution, improved cardiovascular and respiratory health, improved mental health. I didn't have space to put on the slide all the societal benefits that would happen if we were to move away from burning fossil fuels. But there are many, and they typically do occur relatively immediately and to the community taking action. And so this does change the cost-benefit analysis, where now we don't have this mismatch anymore between who and where the costs are being incurred to, and the global and long-term climate benefits. We also have many benefits that are accounted for that are also occurring locally and immediately. And so how do we take this knowledge about these multiple societal benefits of reducing fossil fuel burning, and how do we integrate that into the climate action planning process? And I've had the pleasure to work with C40 Cities, a global network of mayors that are committed to decarbonization, and who are also organizing the largest urban climate action planning program worldwide, affecting over 700 million people. And we've formed a large team of people that includes atmospheric scientists and public health professionals, as well as governance structures and climate mitigation and greenhouse gas emissions inventories. And together we have integrated air pollution emissions and health inputs into scenario modeling. In doing so, we quantify the greenhouse gas emission reductions per sector and the co-benefits for air quality and health per sector. And we can identify triple win actions that reduce greenhouse gas emissions, that improve air quality, and reduce mortality. And I just want to mention a couple examples of how this played out in urban climate action plans. These are real examples. This is a figure from Johannesburg's climate action plan that was just published. And you can see we were able to estimate the percent of total CO2 emission reduction and percent of total PM 2.5 concentration reduction, PM 2.5 being the most health impactful, the most health damaging air pollutant. And we can see where the sectors that are under consideration for mitigation fall out in terms of would reducing emissions from this sector achieve co-benefits for reduced greenhouse gases as well as improved air quality. And we see that mode shift from on-road transportation is one of the most dually beneficial actions that can be taken to reduce both greenhouse gases and improve air quality. The second example is from Buenos Aires's climate action plan, and they compared an ambitious greenhouse gas emission scenario compared to a base scenario, and they see that their PM 2.5 concentration dropped from 12 micrograms per meter cubed in 2050 to about 8 micrograms per meter cubed in 2050. And that got them below the World Health Organization guideline of 10 micrograms per meter cubed. Now that WHO guideline has just been revised and dropped to 5 micrograms per meter cubed. So there's still a little bit of ways to go to get to that below that new World Health Organization guideline. But this is one real world scenario where a city is able to integrate air quality considerations into their climate action planning process. We still have a ways to go to scale up these efforts and integrate these health and environmental co-benefits into climate action planning worldwide at multiple administrative levels. And I'm looking forward to hearing the other panelists today and looking forward to the conversation to think through how we get that done. Thank you.
Thank you so much, Susan. The importance of health co-benefits in terms of really motivating and delivering climate action, I think is really, really critical. And I'm really delighted that we started with a talk on that, and we'll be coming back to it in our Q&A. Now I'd like to introduce our next expert, Dr. Sheikh Dion. Sheikh is a research scientist at the African Center for Meteorological Development, ACMAD, based in Niamey, Niger, as I mentioned. And he holds a PhD in atmospheric physics, focusing on atmospheric convection over the Sahel during the monsoon season from the University of Cheikh Anta Diop in Dakar, Senegal. His research covers a large range of tropical and mid-latitude meteorology and climatology, including weather regimes for the region. And in particular, he has an interest in early warning systems and has been working with the health partners in the region on meningitis outbreaks. And we're absolutely delighted to have you here to give your presentation. Please take it away.
Thank you, Ellen. Good morning to everyone. I'm happy to contribute to this webinar. And today I'm talking about the meningitis outbreak focus over the African meningitis belt. This work is supported by the GCRF African SWIFT. And I also would like to thank all my co-authors for their significant contribution. Why we are focusing meningitis? Here, I just show a map from WHO indicating meningitis incident over the world. And we can see that over Sub-Sahara Africa, we have several countries that the incidence is more than 200 meningitis cases per 100,000 inhabitants. And this region extended from Senegal to Ethiopia, namely the meningitis belt covered around 26 countries. And it is well known from past studies that there is a link between climate and the meningitis outbreak. The meningitis outbreak are mostly observed during the dry season. And the Merit project did a lot of work on helping ACMAD to produce an early warning for meningitis. And we based on the SWIFT sub-seasonal to seasonal testbed to develop useful climate information services to support decision-making over Africa. And in this framework, we are supporting WHO to defeat meningitis by 2013. This co-production is between ACMAD, Pan-African Institution, and WHO Afro Regional Office of Africa, based on Ouagadougou as focus user. ACMAD is a SWIFT partners and a focus producer. And WHO is coordinating meningitis action over the African meningitis belt countries. In this co-production, we are using sub-seasonal focus data from ECMWF, provided through the SWIFT testbed, and also made available by WMO sub-seasonal to seasonal prediction project. And from this database, we are looking at the temperature, relative humidity, and the last available dust focus to make an early warning system for meningitis. We also use meningitis cases reported by WHO to evaluate the focus. For this early warning system, we have selected 3 vigilance level. The red vigilance meaning that atmospheric conditions are much favorable for emergency of meningitis, and meningitis cases are very likely and epidemic status is possible. This vigilance level is advising health services to strengthen meningitis surveillance and systems. We also have an orange vigilance, meaning that atmospheric conditions are favorable for meningitis cases, and it's advise health services to activate meningitis surveillance and system. The yellow vigilance is means that meningitis cases are less likely. And here in this slide, I show two early warning systems for week 1 and week 2 that we are providing every week from week 1 to week 26, corresponding to the period of the dry season of West Africa from January to end of June. And this early warning system is sent by email to WHO AFRO, which share the bulletin to health services in each country, and his technical support like CDC, UNICEF, MSF, and this warning is used for alerting countries for preparedness and awareness for meningitis epidemic. Besides this work on the early warning system, we have this fortnight meeting to discuss on epidemiological situation and discuss also the early warning on meningitis, the control measure implemented and content expected to each country. And depending on the situation of meningitis epidemic and the focus, some country can be recommended to strengthen their surveillance system for the coming 2 or 3 weeks, and also to coordinate immunization and if needed, request for vaccine dose to ICG. In this co-production, also WHO AFRO is giving regular quarterly feedback on the meningitis early warning system to make some improvement. We are co-evaluating the focus based on the report from WHO. We are getting a weekly report from WHO giving the number of cases at the country levels. And here in this figure, I show how these cases can be linked with the vigilance level that we are using to produce the early warning system. And here we can see that the vigilance level captures the intensity of or the magnitude of meningitis cases at the country level. But in this evaluation, we are getting some challenges due to some time for the red vigilance that we are focusing over inhabited or inaccessible area in the meningitis belt. We also have some challenges about the discontinuity of the report from the country and the specificity of the meningitis transmission related to close contact. And to co-develop some research question, in this co-production, we are looking on others area, for example, over Central Africa or East Africa, to further document the drivers of climate linked to meningitis outbreak. Here, I just show an epidemic of Banalia in DRC this year, starting in week 18, corresponding to the early May. And here we are looking at how the way the was, for example, during this period, giving here the mean, the minimum temperature. Sorry, here we have the mean in red, and the variability in color. And here we can see that in this year, we are getting very warm temperature, nocturnal temperature over Banalia, and this was associated with the dry air over this region. And what we are looking as a scientific research question is what are the drivers of climatemetrics linked to this outbreak compared to, for example, what we are using or what we know from West Africa, and also for medical services to work on laboratory to identify some serogroup. In a summary, this co-production is building capacity for climate scientists and health experts on co-production. And it is allowing to develop some skill on generating and understanding climate information services. It is allowing health services to have a free access to useful and accurate climate information and services for preparedness and awareness to save life and damage associated to the meningitis. This framework also allows climate scientists to evaluate and also improve their focus and develop research questions on meningitis outbreak of Central and Eastern Africa. It is allowing also the working group to work on a roadmap of country prioritization for implementation of the regional framework of defeat meningitis in Africa by 2030. And this roadmap is including climate information and climate burden and the weaknesses of health services at country level. Thank you for your attention.
Thank you, Sheikh. That was fantastic. And just to a sort of personal level, I was very much involved in the early days with MERIT and the initial idea on the meningitis forecasting for the Sahel. And just to see how that has become an embedded, institutionalized process with a real partnerships between the different institutions and the role that climate services is playing is just absolutely fantastic. So thank you very much for that presentation. I'd now like to introduce Dr. Vijay Limaye. He will be joining us from his phone, so we may or may not be able to see him, but we will be able to see his slides. Dr. Vijay is a climate and health scientist at the Science Office of the National Resource Defense Council based in New York. He's an epidemiologist and has an interest in addressing international environmental health challenges, in particular, quantifying, communicating, and reducing the risks associated with climate change. Key interest is in the public health burdens of air pollution and extreme heat. So Vijay's presentation today will focus on financial costs of climate change-related health problems. And despite the growing significance of this cost, Vijay says there are frequently absent from climate impact assessment. So over to you, Vijay.
Thank you, Madeline. Really appreciate the opportunity to be with you all. And thank you to my co-panelists as well. So today my presentation is going to focus on the financial angle of the health implications of climate change. You heard great content already from Susan on the benefits in terms of climate action. And this presentation will, I think, round out that information and hopefully add some insight on the cost side. So go ahead, Ian, with the next slide, please. So when we think about climate change, just focusing on the United States, for example, in this year, we have seen, as many of you are aware, a real acceleration of climate-sensitive disaster events around the world. And the US is certainly part of what's been happening this year. In fact, our federal government in the United States estimates that the United States just this year has already experienced 18 what are called billion-dollar climate and weather disaster events. These are the costly events depicted on this map, many of which, not all, but most, are sensitive to a change in climate and are expected to worsen in frequency, intensity, duration, or just spatial extent into the future due to the accumulation of greenhouse gases in our atmosphere. So for example, we've seen really dramatic historic wildfires out west, a prolonged mega drought in the southwest, and increasingly damaging coastal storms, especially in the southeast in our country. So the United States has been tracking how these costly disasters are stacking up year after year. Our National Weather Service folks have been tracking the financial impacts of these climate and weather disasters in terms of losses to property, crops, and infrastructure. But there's a big gap in our understanding of these costly climate impacts, and that gap is related to public health. Next slide, please. So when we think about all of these events, we've been really looking to shed some more light on the costly human health implications of these types of disasters. So a recent study I led looked at 10 different case study events across the United States. Each of these types of weather disasters, climate sensitive events, is expected to worsen in the future according to the science. Right now, though, we really don't have comprehensive, adequate tracking of all the illness, injury, and death that is triggered by these types of events, whether we're talking about wildfires, deadly air pollution, or the increasing spread of infectious diseases like West Nile virus or Lyme disease. So this map really depicts a case study set that we sought to utilize as an example of the types of costs that Americans are already paying to deal with the types of problems that climate change will certainly make worse. Next slide, please. Our study investigated publicly available data sources on health impacts, so those illnesses, injuries, and deaths, and sought to connect that public health data with estimates on the economic side of the financial impacts of all of these health problems. So we're talking, of course, about the financial impacts of premature mortality using government statistics for valuing statistical lives, but also the financial costs associated with costly medical care. Many of you are probably aware that medical care in the United States is extraordinarily expensive, especially if you're receiving it in an emergency room or if you lack access to affordable health insurance through your employer. But we're also trying to account for the whole range of other costs involved with dealing with a serious health problem, like losing wages if you're away from work, or the need for ongoing outpatient care or home health care, people to visit your home and help you rehabilitate and recover from an injury, for example. We're also trying to track the costs of prescription medications. Oftentimes people are burdened with chronic health conditions after experiencing a climate disaster and are incurring these costs for months or even years in the future. Next slide, please. So this slide really depicts the types of data sources that we relied on. We spent the better part of a year scouring public data sources and ended up with nearly 36 of them. This table really depicts the widespread nature of this data right now. We don't have a central clearinghouse for climate and health data in the United States, and certainly in most countries. And that means it's a very slow, cumbersome process to actually identify the health implications of each of these types of climate worsened problems. The longer it takes for us to collect that information, the longer it takes to report financial impacts. And we really are kind of in need of much more timely reporting of the health problems associated with these events into the future as we face mounting risks. Next slide, please. In terms of the specific health problems that we're talking about, you've heard a lot already today about different health impacts of climate change. I've included the citation in the paper's public access, so I won't spend a whole lot of time on this slide, but just to say that there's all sorts of health problems you may not think are linked to climate problems, but they actually are. So things like pregnancy complications after a severe storm, or cardiovascular or lung problems from breathing in wildfire smoke, even if you're not in the direct vicinity of a fire. So we tracked dozens of really kind of grim health problems associated with each of these events. This is all just what was available in the public data. So we're likely still just scratching the surface in terms of our understanding of all of the specific health problems triggered by extreme heat air pollution, and the rest listed in this chart. Next slide, please. So in terms of the ultimate numbers, here's what we ended up from our case study set. This is just a sample of events in 1 year, 2012 in the US. We ended up, just from this case study set, just scratching the surface on climate and health, with more than 900 deaths and about 20,000 hospitalizations and emergency room visits just from this case study set and the public data. When you attach the economic costing to those health impacts, you end up with more than $8.6 billion associated with premature deaths and another $1.4 billion associated with illness and injury. So we're talking about a $10 billion price tag just from this small set of climate sensitive events in 1 year. To give you some perspective, the total disaster total from our government, excluding health impacts, was about $40 billion that year. So we're adding about 25% on the price tag of climate change when you consider just this small set of health impacts. Next slide, please. So when we think about what this means, I think, really for me, the take home is that we really are vastly underestimating the financial costs of climate change because we're not considering fully the impacts on human health. On the flip side, that means that actions to reduce greenhouse gases right now can help to avoid longer-term suffering and mounting financial costs. Similarly, investments in keeping people out of harm's way, in climate change adaptation to prepare for unavoidable harms, can reap huge financial benefits and can make these adaptation efforts more cost-effective. We also, of course, need better surveillance and tracking. We can't be relying on slow public reporting of health problems associated with climate events. We need much more proactive approach and better funding for public health agencies around the world. We think these better cost estimates that include public health can make it even more clear how urgent the challenge is and the need is for climate action, both on mitigation and adaptation. So I'll just wrap up with 1 or 2 more slides. I think working in this space can be kind of difficult and challenging, and a lot of us can lose sight of the progress we've already made. This is a picture where I work in New York City in 1966. It's unrecognizable to most people today, and if you can click next, Ian, you'll see that the financial benefits of the Clean Air Act that we've achieved over the last 30 years, let's see if it'll display or not, they outweigh the cost of implementation by a factor of more than 30 to 1. So we've already made gigantic progress in the United States through mitigation of fossil fuel pollution. And the same certainly goes for the climate problem. Next slide, please. So you can see that we've actually achieved about $2 trillion by the government's estimate in health benefits from cleaning up our air. And similarly, on the next slide, I think there's a strong case to be made that action on the climate problem can save huge numbers of lives and certainly billions of dollars in health costs year after year. We need to be thinking more comprehensively about the risks and costs of continuing to delay and dither on this problem and capture these huge benefits for public health around the world by pushing for stronger climate ambition on mitigation and adaptation. With that, I'll wrap up. Thank you.
Thank you so much, Vijay. That was really interesting, and particularly putting the numbers there and the dollar values, I think, is just incredibly impactful. I do realize that, of course, the US does have a lot of data and it does have a lot of resources to understand what is going on, and just thinking how we might get that type of information to policymakers in lower and middle income countries where they can see as well the economic value of cleaner air and cleaner cities and a low carbon future, I think is really important. So thank you so much for that and for all of the details that you provided. Now we'll go on to our final panelist. It's Dr. Pei Huang. Dr. Pei is from the EPA in the USA, and she's a senior scientist at the Center for Environmental Measurement and Modeling in the Office of Research and Development. Dr. Huang's science for community resilience portfolio includes flood-induced contaminants, fate and and transport from toxic sites, feasibility of solar economy for local government, and assessing mosquito-borne disease risks through environmental and socioeconomic determinants of mosquito habitats. She has also held positions at the World Bank and previously at USDA. And here today, she's going to give us her insights on building community resilience and taking a systems approach. Pei, over to you.
Thank you, Madeline, and hello, everyone. First of all, can you actually see my slide in the presentation mode?
Yes.
Just
very good.
This conversation, I hope to convey the importance of taking a holistic and science-based systems approach to inform decision-making. So in my slides, I will highlight a couple of our weather, climate, and health work to underscore the needs of systems approach for community resilient planning. Our systems research is inclusive of environmental science and socioeconomics, and our stakeholders are often overburdened community. I want to acknowledge there are more than 30 researchers and partners who have contributed to our work I'm presenting here. Okay, so just to illustrate the relationship between environmental science and socioeconomics, here's an example of mosquito risk mapping in Brownsville, Texas. City of Brownsville was the second city identified with locally transmitted Zika back in 2016. As you all know, Zika is transmitted by infected Aedes aegypti and Aedes albopictus mosquitoes. So we work very closely with the city's Department of Public Health to understand the interactions between Aedes abundance and land cover, meteorological conditions, as well as the socioeconomic determinants to map the Aedes risk. The published result actually indicates, in addition to weather, land cover, human population is also a very important key factor in driving which Aedes species is prominent. And this result was used to inform the city in placing the mosquito traps, as well as the city's mosquito control strategy. And our second example on system-based research is a framework to assess flood and climate vulnerabilities of regulated contaminated sites in the United States. Recently, flooding and contamination have raised a lot of attention, not only just in the scientific community, but also in government as well as in society in the United States. The inundation of contaminated sites could potentially release toxics into the floodwater and transport contaminated soil into surrounding communities. So with the increases in intensity and frequency of flooding, these communities are likely to bear greater health risks from climate-driven extreme events. United States Environmental Protection Agency is authorized to clean up some of the most contaminated land to protect public health. So in our framework, there are two components. To the left, there's a screening level framework, and which is to rank climate and flood vulnerabilities for several contaminated sites. And in parallel, to the right, we have simulated community scale flood-induced contaminant transport. But really the key enabling factor is actually in the middle, which is the partnership and partnering with the communities to really make the framework works. So here is a quick overview of our study area. There are 168 US regulated contaminated sites in this area, and 17 of them intersects with 100-year floodplain more than 50%, and 28 of them intersects with 500-year floodplain by more than 50%. So the example of the screening level assessment Our products is actually an interactive mapping, but for the purposes of presentation, this is a static shot of the tool. The users has the flexibility and can select and weight their impact factors of concern from these 13 GIS criteria on the left column. This 13 GIS criteria includes flooding, sediment, and 7 socioeconomic impact factors. The sample map that is showing here is preset with 100-year floodplain, Category 4 storm, intermediate low sea level rise, and very important socioeconomic factors. The red color dots indicates the most vulnerable sites that are actually mostly located on the coastline. And our emergency preparedness partners also wanted to have a real-time weather hazard information. So we collaborated with the United States National Oceanic and Atmospheric Administration to port their data, their real-time data into our map, which you can see the coastal precipitation monitoring sites. And the blinking red bubbles means is actually above the average precipitation level. So lastly, I'm sharing with you a sample of site-specific simulations. There are 2 prominent locations I'd like to point to you on the site. One is a neighborhood that is near the contaminated site is often experiencing flooding. And the second is a national wildlife refuge. And there is a contaminated unit, which is this white area, sits in the middle of National Wildlife Refuge, and there's a creek running through that area. So they want to know how flooding and would transport those contaminants. So we mapped the geospatial and temporal distribution of those sediments as well as contaminants in multiple flood scenarios. And to the left, you will see the animation show 10-year, 50-year, 100-year, and 500-year flood-induced sediment transport. And to the right, it shows an example of contaminant transport. What you will find is the sediment volume increase post-flooding in some area, for example, to the east of National Wildlife Refuge. And however, if you look at that, one of the contaminant of concern in this case is arsenic. In the same area, the arsenic concentration actually decreased post-flooding. And why is that? This is due to the transport of low arsenic containing sediment from south of this 84th Street Avenue to the higher concentration arsenic area in Tanakan Marshes area. So what our results is being used for? Our result is being used for to inform the cleanups in the neighborhood and the National Wildlife Refuge, which will then reduce the health risk and build flood resilience. Now the question is, how well would a 2021 resilience plan work 30 years from now? This concludes my presentation, and thank you very much for your attention. Back to you, Madeline.
Thank you so much, Pei, and what an important question. I think that's really a key to our thinking about adaptation. We have to adapt to the climate that is happening, and the climate is changing. So adaptation strategies for today may not be suitable for tomorrow. So that dynamic response, as you've laid out there, I think is just so important. So now what I'm going to suggest is that as you put in your questions to the panelists, and I'm going to just make a few comments and then come back to that. So what has been presented here today is all very dear to my heart. I've been working at the Climate and Health Nexus for at least 20 years. And to be honest, it was a very slow start. Now you really see that climate and health, this nexus is rapidly becoming a key opportunity for both mitigating and adapting to our changing climate. You'll all be aware of the importance of the Conference of Parties, COP26, conference that is due to take place in Glasgow in the UK next week. This conference will bring together all of the global leaders that and their negotiating teams to raise ambition and take urgent action to mitigate the effects of greenhouse gas emissions on our climate, in line with the Paris Climate Agreement of 2015. Governments from vulnerable, lower and middle income countries, which have done very little to actually contribute to these greenhouse gases, will be looking for not only the wealthy countries mitigate their emissions, but also they need support to adapt to the changes in the climate system that are already baked in with the emissions to date. However, the meeting in Glasgow is not only for governments. Multilateral organizations, civil society, academia, philanthropy, businesses, and the media will all be in attendance, in part to ensure accountability and transparency in the negotiations, and because each community has a role to play in delivering on Paris. And I'm just going to highlight 3 of the many events that will take place at COP and encourage you to participate online. I was hoping that to send a link to the climate and health events throughout the whole of COP in the chat for all of you, but unfortunately that link is not yet there. It will be made available in the coming days. So if you're interested, many of the events at COP are available online. There is an unprecedented amount of climate and health activity at the meeting. The events that I'm going to mention are in part supported by the Wellcome Trust, where I work. And in fact, many of the COP side events include Wellcome grantees who have undertaken research at the interface of climate and health. For those of you not familiar with the Wellcome Trust, I'll just say a couple of words. We are a politically and financially independent charitable foundation headquartered here in London in the UK. And our vision is to support science to solve the urgent health challenges facing everyone. And we plan to achieve this vision in different ways, giving researchers the freedom to make discoveries that change the way we see the world, and using science to find solutions for 3 of the world's most urgent health challenges. And these are mental health, infection, and climate change and health. So our new program on climate change and health is just beginning. So it's a very exciting time for us. The 3 events that I want to highlight that will be happening at COP characterize some of the discussions that we've had today. So the first one is that there's a new health and climate network that has been created, which is an alliance of organizations working to put positive health outcomes at the center of responses to the climate crisis. And the network advocates for evidence-based policy solutions that save lives and improve global health with a focus on food, energy, transport, and the health system. It's produced a series of briefings on suggested evidence-informed actions national governments can take to jointly address the climate crisis and poor health outcomes, including non-communicable diseases, which cause more than 70% of global deaths. So the Health and Climate Network has 4 events at COP26 on food, energy, transport, and health systems. So I suggest you look out for their online presentation, really showing that these new partnerships are being established between the health and the non-health community, all looking to improving health outcomes in the context of climate change. There is the WHO Global Conference on Health and Climate Change, which will take place on the 7th. On the 6th of November, with a special focus on climate justice and a healthy and green recovery from COVID-19. It's a whole day of meetings, most of which will also be available online. And I hope the link to that will be put into the chat. What I think you'll see during the conference altogether is that there's an increasing interest in the health. It's increasingly apparent that the health community cannot protect health if they are not fully engaged with non-health societal actors, either government ministries, the private sector, etc. And there really is a role to play for everyone when it comes to protecting human health. And then finally, I'm going to mention there is a climate services panel on the 8th in the Health Pavilion. This is being organised by a new, well, it's not immediately new, it's a joint office of the WHO, the World Health Organization, and the World Meteorological Organization. And it's a panel discussion on climate services for health, which I'll have the pleasure of moderating. The joint office, if you don't or are not aware of it, is a particularly important development in the journey of integrating climate into health prevention and response. It was established in 2014. It has already undertaken a number of activities to bring these two communities together. One such activity is the creation of the Interagency Health and Climate Study Group, which is laying the grounds of a new department of health at the World Meteorological Organization to sit alongside its current user-focused departments in agriculture, water and disasters. So that's an exciting development that's happening there. So there are many other events, climate and health events, that can be found online. And as I said, the information on those events will be coming available in the next couple of days. So please look out for them. So now I just want to go back to our panelists and, you know, just all of the richness of the information that they shared, not only on the value of health in providing, if you like, the co-benefits, economic and health benefits of climate mitigation, which we heard from Susan, the development of climate services for health from Shek's presentation on meningitis, the importance of data and costing things in detail, which I think was really valuable from Vijay, and then Pei's systems approach, really looking at the complexity and how you can use tools to really show how complex systems work and how that information can be taken to decision makers. But before we go to the audience, I just would like to go in the same order of the presentation through our panelists to ask a question, and that is, there are many reasons why it's important to have health on the table in climate change discussions. So if each of you could just say either or both, if you really want to, the biggest opportunities for health to motivate climate change action and the biggest opportunities to protect health using climate services and science. You can answer, like I say, very briefly, both of those or one of those questions. And I'll first go to Susan. What's your take on that?
Great question. Thank you so much for that one. Given that air pollution is the fourth leading global health risk factor, that is not the fourth leading environmental health risk factor, but the fourth leading overall risk factor, just behind tobacco smoke and dietary risks. And there's one I'm missing, physical inactivity perhaps. But given that it's the fourth leading public health risk factor affecting premature mortality and ill health worldwide, I think that, and the fact that it comes from the same sources as greenhouse gases. Anytime we burn anything, primarily fossil fuels, but also biofuels, we're releasing both greenhouse gases and air pollutants. So by burning less fossil fuels, we achieve those co-benefits for air quality and for health. And I think that's a massive opportunity for improving health and motivating more ambitious action to reduce greenhouse gases. In terms of climate services and sciences, one of the key limitations, and I'm going to put this in the Q&A as well to answer the question that was posed to me in the Q&A, but one of the key limitations is that we don't know what air pollution levels are worldwide. And there are many great people working on this, and we now have satellite data that can really fill in the gaps because we have very few ground sensors in many parts of the world. And so I think this is the data availability issue is one that is being addressed and will be improved in the coming years.
Thank you so much. And now over to Shek. Would you like to answer one or both of these questions?
Yes, I would like to answer to climate services. I think climate services is very important to help health service to be ready to take action, and this is very important to limit like some epidemic, the impact of epidemic on the population. I think the limitation that we are feeling is how we can get accurate focus, and also how we can monitor climate information over, for example, over Africa, where there is no sparse observation. But around others area in the world, there is some action to be in development, or to be ready to help health services to improve their action. Thank you.
Thank you. Thank you. And Vijay, are you able to respond to one or both of those questions?
Sure. Happy to. You know, when I think about the health argument for climate action, I think about just this year and how clearly on display it is, you know, the fact that we have built human society, you know, on the assumption of a stable climate. And certainly this year, we've seen tremendous suffering from climate hazards, in part due to the fact that our systems are so interconnected. You know, we have transit, energy systems, food systems that all rely on a fairly predictable climate. And that assumption is more and more no longer holding. So this is really about ensuring a livable future for all of us. So for so long, the climate problem has been framed as a distant threat or one to glaciers and polar bears, but it's really about you and I and all of us, you know, moving forward. So to me, the health implications of a changing climate are really central to motivating more ambitious action. In terms of climate services, I think that we need more attention to be paid to using climate services to inform adaptation responses, taking better advantage of 21st century technology, for example, to institute more effective, comprehensive early warning systems to prepare people, not just for extreme heat, but all of the sorts of climate risks that we know people increasingly are facing around the world. So I would like to see more collaboration between the climate services community and technology experts and public health experts to ensure that messages are reaching people, to ensure that people, for example, take extreme heat as a serious threat to public health, not just an inconvenience, but something that can be deadly. So I think there's a lot to be done on the adaptation front in terms of informing a more health protective response.
Thank you. And finally, last but not least, Pei.
Wow, this is a really quite challenging question. You know, it's like, what is the biggest opportunities? I think especially from both my professional experience, which I start with air quality, then I moved into the water quality, and now I'm doing soil and contaminants. But I think, you know, one of the things is from our agency, which is the United States Environmental Protection Agency, our bottom line mission is really to protect public health and environment. And I think what's really important is that not only is our mission, but also we're authorized and across media and authorities is to protect the public health. And that includes air, water, pesticides, and other. Recently in October, we just released the Climate Adaptation Action Plan, which I'll be happy to share with you. You can let me know if I should share in the chat or at the end. But the key point is there's a couple of things there. It's a really good document to look at because and really highlight some of what we consider really important actions that we need to take. For example, one action is that EPA will consult partners to increase the resiliences of the nation with a particular focus of advancing environmental justice. All right. It's very key in our action plan. Another example is that opportunity is to develop like science-based decision support tools for decision-sensitive to climate change. And also, and especially highlight that EPA will update the climate adaptation plan into our programs, our policy, and rulemaking process. I think this is very powerful. What I will continue to do as my little area, I will definitely continue to work with overburdened community, which is part of the environmental justice community. And also, what I would like to do is I would like to continue the effort to focus on engaging the stakeholder and use the science-based decision support tool.
Thank you so much. So we have a whole bunch of questions coming into the chat. I'm just going to take the questions first, which are addressed to individuals, and then we'll have some of the questions that are more open to everybody. So we have a question here for Pei from Kidanu Walder Medhin. Dr. Hong, you do not consider income as a variable in your analysis. I think it needs to be addressed as an economic factor to be considered.
Totally agree. So perhaps, excuse me, perhaps as I went through too quickly. So if I may draw your attention, Madeline, if you don't mind if I share my screen again.
Sure.
So for our mosquito risk mapping effort, the list of variables does include housing income housing value, which is a proxy we use for income because we don't always have the accurate numbers for the income level. So I just want to emphasize the income level is considered in our variables, except we use the housing value. And in terms of our sort of impact factors, as you can see that we actually inclusive of the low income populations. So we have actually data layers from this study area to really look into the low income population. And in our site-specific analysis, as I pointed out, a lot of and many, perhaps majority of the neighborhoods and communities, and those are associated in this case, a national priority list, what we call the Superfund sites, tend to be low income communities. So inadvertently, that it is part of our study, but I totally agree with you. Income should be considered. Thank you.
Okay, thank you so much. And so now we have a question for Sheikh. Is anything being done to duplicate the work you describe on other tropical diseases in Africa?
Yeah, thank you for this question. Very interesting question. Yes, in ACMAD, we are working to try to produce climate services for tropical negligent disease like malaria, Rift Valley fever, and also cholera. This is a work ongoing in ACMAD. Thank you.
Okay, excellent. So I have a quick question for Matilda Rustiku, and that is, could you please repeat the announcement of the meeting you are talking about? I have put a link into the chat for the Global Conference of Climate and Health, which will take place next week. So you can follow that online if you want to. And so that's that question being answered. And then we have a question here from Francis College. How do we ensure, and I think I open it up to the panel, how do we ensure that climate services for health are not just concentrated in the vertical, where it's also important to take into account an integrated approach across the horizontal, seeing how climate services impacts water, food security, energy, etc., as well as health. So is there anybody who wants to take a first stab at that? So I will come in on something while the rest of our panelists are thinking about how they might respond. I do think that's a really important question. Even as we tend to be very focused on single diseases when we look at the development of early warning systems, but then we also recognize that the health service, the same physicians, the same medical staff, the same health professionals are having to respond to multiple climate sensitive diseases at the same time. Following the rainy season, they're looking at diarrheal diseases, they're looking at malaria, in the dry season, they're looking at rotavirus, they're looking at meningitis, etc. So if we create bespoke systems for each individual disease, maybe using a different tools, different approaches, different types of analysis, they will then have a plethora of different things that they'll have to deal with, and that will become very challenging. So I think that comment is a very important comment, that we need a bit of a systems approach. We have case studies now, and I think the meningitis is a fantastic case study, where we have to think, how do we roll this out across systems? Because at the same time, communities are being affected by infectious diseases, they're being affected by the development of their crops, pests on their crops, water shortages, etc. So that's my take on it. But does anybody else want to come back in on that?
And add something, Madeline, that I completely agree with you that having multiple systems it's the same individuals that are having to respond to this, and we want to be very mindful that we're not overburdening those people with multiple different systems that they have to be aware of and figure out how to use. In addition, there's an additional health challenge that some of these risk factors that are affected by climate change act synergistically with each other. So just as an example, increased air pollution makes people more vulnerable to infection. We've seen this with COVID-19 and wildfires, that increased exposure to wildfire smoke results in increased cases of COVID-19 and increased severity of COVID-19 with more COVID-19 fatalities. And so we can also think, just this is sort of within the health sector, we can't think about each individual health outcome or disease individually, but rather how they all interact with each other.
Thank you. And just a follow-up question here, which I think should go to Sheikh, and that is regarding the vigilance levels for the early warning system for meningitis. How might this integrate with warnings for other hazards? So we've not only got the integration across the health system, but we've actually got integration for other hazards, such as high impact weather, which also use these types of color codes and have associated advice with them about being prepared and ready to take action. So Sheikh, you're sort of like, do you see the early warning system for meningitis fitting into the rest of the hazards early warning systems?
For this question, I think the early warning system for meningitis is like an guide for health services. And it's not like an hazard because it is recurrent seasonally. It is something occurring every year during the dry season. And what we can learn from this disease is that there is some knowledge that this meningitis is developing, for example, for before and thus even, for example, and this can be predicted 1 week or 2 weeks ahead. And I think from this orientation, I cannot say that it is like a big hazard as we are having it every year. But what I would like to share here is that since the massive vaccination in 2010 from WHO, there is a significant decrease of meningitis outbreak over the African meningitis belt. However, we are getting some sporadic outbreak, like locally outbreak. Yeah. And maybe in the future, this locally outbreak should be like hazard.
Mm.
And we have to recognize also the effort from WHO in massive vaccination and surveillance of meningitis.
Thank you so much. And I think, like, for those in the audience who don't come from a sort of highly endemic area for meningitis, it's certainly in the UK or the US, a few cases of meningococcal meningitis is considered an epidemic. But where you are looking at the Sahel, we're seeing what would be considered to be totally unacceptable levels of meningitis as a routine. And I think your point there is really well taken. And fortunately, the vaccines have made a big difference in the region, which I think is really important. So I have a question now for Vijay. It says, Vijay, what does your research tell us about how the cost burden of climate-sensitive events is falling on government, individuals, families, employers, and health insurers?
Okay, thanks, Madeline. Yeah, I think it's a good question in terms of we've identified a bunch of costs, billions of dollars in health harms and the need to treat those costs. But the question then is, who's actually paying for those costs, right? And so right now, we actually don't have great insight into the actual payers of the bills for medical treatment, for example. We right now estimate through just our preliminary work that in the United States, Medicare and Medicaid patients, so these are typically the very young, the very old, economically disadvantaged groups, are paying a disproportionate share of the cost to treat climate-sensitive illness, well over what their share of the population might suggest. That finding makes sense in terms of our existing, understanding of who's most at risk from climate hazards in terms of health. But we really right now lack insight into the financial implications of climate change for health insurers, for example. It may be the case in the future that, health premiums become very high in certain places because of multiple kind of overlapping climate hazards to health. You can imagine that people enduring year after year of wildfire smoke, for example, are going to be burdened by a lot of costs to treat those problems, and certainly our insurance and actuaries will respond. So this remains kind of an active area of investigation for us, but we need much more integration of health economics databases with our electronic medical records. Unfortunately, the integration is just not there right now to adequately answer that question.
Okay, so thank you for that. Here's a question for all of you, and see if anybody's got any good ideas. It's from Syed Mod Asghar Rizvi, and it says, artificial intelligence would be helpful to mitigate effects of weather impacts on health fitness. So that's a question mark. What's the role of artificial intelligence in improving our understanding of climate and health and improving our response? Does anybody have anything to say about that?
I can just offer some thoughts that I definitely think that artificial intelligence and machine learning approaches can be very valuable in helping to predict where we might expect to see health risks from climate change. And we have many people working on this in the research space, trying to figure out how do we predict cholera, where cholera habitats will form, or where wildfires may occur as a result of weather changes. Part of the challenge is that when we think about training data for these types of approaches, we have data from the past, and that is not necessarily adequate to be able to predict a climate change future. But I think that there's a lot of advances in this space in the research, and I'm very optimistic that when those sort of transition to operational systems, that we will be able to, not just predict where the health risks are occurring, but deploy resources to ensure that people have access to medical care and adaptation services that they need to protect health.
Thank you. Anybody else got a quick comment on AI? Oh, then we'll just move on to the next question, which is, what suggestions do the panelists have to incorporate extreme weather and climate scenarios into future resilience planning? I'm going to hope that somebody else will answer that first, and then I'd like to say a little something about that. Hey?
I'll give it a try.
Thank you.
One of the things that in our community, which is part of our research, is working on downscaling of climate, and not only on that, focusing on downscaling, but also we have a focus on the downscaling the IDF, which is precipitation intensity, duration, and frequency. So, and the effort and which is being tested at this point is to use those forward projecting maybe 30 years or 50 years or out to 2100s IDF curve. And in order to have a better idea of not only the precipitation intensity, duration, and frequency, but also really looking at in the discharge aspect. So that will at least address one aspect of the extreme weather event, which is flooding. So that will be one thing to share with you all.
Okay, thank you. One of the things I'd like to comment on that is when we think about climate information in the near term and in the longer term, we really need to think about what types of decisions we want to address. And quite often you might have information at a locality, like where you're working, Pai, where you want to know, you kind of want to know a long-term idea, but there's a lot of uncertainty attached to that. So you then need to bring it back to the moment and say, well, what can we do? What is the decision we have to make today? Is it that we are making a plan that is going to be in concrete for the next 50 to 100 years, in which case we're going to have to take a best guess? We're going to have to manage the risk of the uncertainty that's associated with that. Or can we have some kind of adaptive solution so we don't lock ourselves in, but we put in a certain level of resources to protect ourselves today, to manage the risks for today, to set ourselves up for managing the risks of the future, but we don't over-engineer it such that if the world doesn't work exactly as we predicted, which is highly likely, then we still have the opportunity to change and adapt our decision-making process. So I think that sort of understanding what is the decision you actually need to make, and then what allows you to build on that decision will then enable this sort of cross timescale opportunity.
May I follow up?
Sure.
You said I'm very, very jazzed by what you just said, because I think this is the efforts that we are working on right now, which is, for example, coming back to what I share with you in terms of managing the mosquito risk, right? Manage it now by really better understanding the distributions of those mosquitoes. But then what we can do is just study and really design a pesticide, for example, insecticide control strategy. But that does not stop us to think, okay, with the change of, for example, the income level, the population, and the weather patterns, is the land cover, for example, because the landscape is also a very important part of the mosquitoes, for example, right? So not only we do it in now, but also thinking into the future, so we can have a more of a futuristic resilience planning. So I thank you for mentioning. I'm very jazzed by what you did.
Well, we have an excellent question to follow this up, actually, which you may want to pick up, but also other people on the panel may want to follow. And that is, where do you see nature-based solutions fitting best into health and climate? And this is from Anton Tacoma. So does anybody want to make a comment about nature-based solutions?
I'll just speak from the perspective that I typically work within of transportation emissions and the air pollution effects and health equity concerns that occur as a result of where our highways are and how people get around town. There are a lot of ways to reconfigure our cities to expand natural areas that promote recreation, promote physical activity, and promote cardiovascular health, as well as mental health by sort of having that centering experience through exercise and physical activity and being close to nature. And so I think that reconfiguring cities, and we see some examples of this in Barcelona with the super blocks, and there's some really great examples of highways coming down and new natural spaces expanding to fill those spaces within our cities. And I think that's a really, I talked about triple wins. That's not just a triple win, that's like a quintuple win or something, because it has so many benefits for urban health to expand natural spaces within our cities.
That's great, thank you. Oh, so who else was going on?
Yeah, I agree with everything Susan said. I think also, it's clear that nature-based solutions, urban greening efforts have the potential to dampen the urban heat island effect, improve stormwater regulation and management in cities, maybe even improve air quality on the local level. I think, probably a small carbon sequestration component there as well, but I think traditionally these haven't really been viewed within an adequate kind of health framing, and certainly I think that's an active area of research, but we need more investment in city adaptation and deployment of these urban greening efforts, because it seems clear that, not just physical, but also mental health benefits to be gained from these interventions.
Thank you. Pei.
Ecosystem services is definitely very near and dear to my heart. In the interest of time, what I would like to introduce you is we actually have a public website called the Enviro Atlas, and in which, and there's a wealth of not just the data layers, but also the green space and the health interactions between the environment and how that's really assist, for example, even mental health perspective. So I would just stop there. Ecosystem services could certainly positively contribute to the climate-related health issues. Let me share that. Let me find the Enviro Atlas. I'll share in the chat.
Thank you so much. So we have another question here. What lessons are there from COVID that can be applied to meeting the health challenges of climate change? Lessons from COVID. I know that the world has not experienced COVID in the same way, but what lessons do we have that apply to climate change?
I can give this one a try. That there has been a lot of research on what the environmental effects of COVID have been. So the COVID lockdowns and sort of that natural experiment where human activity changed so much, and what did that do to our greenhouse gas emissions? What did that do to air pollution? There's a whole separate line of research about how climate and meteorology and environmental conditions are affecting COVID. And I talked about the wildfire air pollution connection there. And one of the biggest takeaways, having spent most of my time over the last year and a half thinking about that first question, is how did COVID lockdowns affect greenhouse gases and air pollution? My takeaway from this is that we did see some dramatic changes in some locations, but perhaps not as dramatic as people might have expected prior to the situation. And I think what that indicates is that this individual behavior change that we all experienced during COVID, where we stayed home and we didn't drive our vehicles, that is not enough to reduce air pollution and to reduce greenhouse gases to the levels that we need to reduce them to. And we need system-wide change. We need system change, moving away from fossil fuels, and relying on individual behavior alone is not enough to be able to get us there.
Thank you. Well, I'd like to add a comment to that, and that is not thinking so much of the impacts of our lockdowns, etc., on the environment, but just thinking about, you know, two countries which appeared at the top of the global health security agenda for preparedness was the USA and the UK. Both technologically very sophisticated, got good surveillance systems, good labs, etc., etc. Not done well, I have to say, in terms of global statistics on COVID. However, you know, what we've seen is several things. That having technical capability is not enough. You need to make decisions, and you need to make those decisions in a really timely manner. And just in the same way with climate change, I think, is the same issue around COVID, is you make early decisions, understanding the future without having to get into the future before you change your behavior. So actually being able to use prediction and say we have to change our behavior today rather than waiting is incredibly important. And it was important for COVID and is important for COVID. And it's also important for climate change. And then the public engagement. What we saw in the UK, I think, was quite a fabulous level of public engagement generally in responding to COVID, where the level of public response was in many ways way above what the politicians thought the public could accept. We've seen how divisive that has been in the US and in some other countries, and really getting the public on side for climate change as for COVID is incredibly important if you're actually going to change the way the outcomes are going to develop. And then countries working together. Countries thinking about equity around the provision of not only vaccines, but also drugs and services for those affected with COVID, putting financial commitments together, which has been hugely challenging with COVID. It's going to be hugely challenging on climate change. We hope that the COP26 is going to show the best side of decision making, and that people are going to be ambitious and put real money and increase money on the table, and are actually going to act based on the commitments that they make. So I think there's quite a lot of parallels in terms of governance issues and questions about society that link across COVID and climate. Anybody else want to make a comment on that, or should we just move to the next question?
I'd just say, yeah, I agree with all of that. And I think also on vivid display has been the consequences of chronic underinvestment in public health worldwide. Certainly the world economy has endured tremendous harm, in part because we were caught so flat-footed and unavailable in terms of staff, technology, resources to deal with this problem before it got out of control.
So we're kind of coming up to time soon, but I have a couple more questions. So here's one which says, and I open it up to anybody on the panel. What do you think are the main opportunities for budding entrepreneurs from the academic community as well as from business when it comes to addressing the impacts of climate change on health? What is the opportunities for entrepreneurs in this space? Any thoughts on that? You can see that this is all, these are all challenging questions from our audience, but.
Well, I always have opinions, so I could try to jump in here that, I think that when you look at the temporal trends of energy use and what is being burned for our electricity generation, I'll just use the US as an example. It's the place that I live and know the best. Those transitions in, say, moving from coal to natural gas and renewables are mostly because of the changing economics of the cost of those alternative fuel sources other than coal and oil. And so for the business-minded people among us, I think that coming up with solutions that are cleaner and more sustainable and healthier, that are also easier to use, more efficient, and make life better for people in a cheaper way, I think it's not a given that the world will continue to burn fossil fuels. I think we just need solutions that make sense for people on an everyday basis, and make the economics work, so that we can expand clean energy and solutions that are both healthier and reduce greenhouse gases.
Yeah. So I have a question from Jim Jansen, and it says, Madeline, to what extent is the private sector engaged in the projects you've mentioned at Wellcome and elsewhere? So without going into those specific projects, the key, I think, is the fact that businesses are coming on board, and sometimes much more advanced than governments, in terms of looking to decarbonize their own system and their supply chains. And there are a lot more businesses now at COP. There's a lot more investment in sustainable approaches for business, which I think is going to have a dramatic effect going forward. And the key thing, I think, is distinguish it between greenwashing, if you like, where businesses say they're going to do something but don't actually do it, just kind of looks nice, and where businesses really go in deep and say, how are they going to reinvent themselves? How are they going to change the structures that they use? How are they going to not only decarbonize their own direct business, but help decarbonize their supply chains as well? And then they really need to use science-based targets. I think that's an absolute essential criteria going forward, so that what they're doing can be made accountable, it can be transparent, etc. I think our time, however, has come to an end, and I am going to close our meeting and start off really by thanking our panelists, which I think have made a fabulous presentations and a conversation, and our audience who have been so engaged. So very much appreciate the audience contribution here. This is the conclusion of the webinar on extreme weather, climate change and public health, which has been organized by the InterMET.digital. I'd just like to also thank Ian Harper, who is the person behind the whole program. And again, thank our panelists, Susan, Pei, Sheikh and Vijay, for their contributions today, and you, the audience, for being here to share it with us. So thank you and goodbye.